Hello, everyone. My name is Dejanay Williams, and I did my benefit presentation on mental health programs. Throughout this presentation, we're going to discuss a few things. The first being the introduction to mental health, so that way we have a full understanding of what is encompassed within the term mental health. We will also be going over the importance of mental health to the organization. How do we treat mental health, and how does that better benefit us as an organization? We're going to also look into implementers of the mental health programs slash benefits and their findings. When discussing mental health, we must keep in mind that this is a large umbrella with several subcategories falling underneath. These categories include emotional, psychological, and social well-being. Mental health concerns can fall under one or a combination of the three categories. The objective is to treat, retain, and invest in the advancement of mental health treatment and awareness. When discussing mental health benefits, we want to keep the three factors in mind. Mental health benefits produce increase in productivity, increase in morale, and financial gains within the company. As far as productivity, research shows that nearly 86% of employees treated for depression report improved work performance. In some studies, treatment of depression has been shown to reduce absenteeism and presenteeism by 40 to 60%. With morale, it promotes a positive attitude and it strengthens relationships between employees as well as employees and their superiors. Financial gains within the company. Mental health conditions cost employers more than 100 billion and 217 million lost work days each year. As of 2022, 19.86% of adults are experiencing a mental health issue. That's nearly 50 million Americans. In a survey by Harris Poll called the 2022 Work and Well-Being Survey, this was conducted with more than 2,000 working adults between April 22nd and May 2nd. The survey found that 71% believe their employer is more concerned about the mental health of employees now than before the pandemic, while 39% of employees have stated that their workplace environment has had a negative impact on their mental health. While talking about the pandemic, this is a conversation that really stems with mental health awareness and needing of benefits because more people are working from home now than ever. The pandemic has changed everything across the board when we talk about our work environment, which brings new challenges and relieves old ones. So when we talk about the pandemic, we want to make sure that we include that in this slide and as well as the importance of those mental health benefits during the pandemic. Now let's get into mental health and its effect on productivity. Mental illnesses such as depression are associated with higher rates of disability and unemployment. It also interferes with a person's ability to complete physical job tasks about 20% of the time and reduces cognitive performance about 35% of the time. Only 57% of employees who report moderate depression and 40% of those who report severe depression receive treatment to control depression symptoms. Even after taking other health risks like smoking and obesity into account, employees at high risk of depression had the highest health care costs during the 3 years after an initial health risk assessment. Prior to the pandemic, from the years 2008 to 2019, young adults ages 18 to 25 reported at least one major depressive episode in the past year. This went from 8.4% in 2008 to 15.2% in 2019. Women with children, Hispanics, and Black people, the unemployed, and essential workers have been more likely to report mental health issues during the pandemic than the general population. Now, if we talk about post-pandemic, about half of women and a third of men have reported worsening mental health since the beginning of the pandemic, with about a fifth saying the pandemic had a major impact. Now, if we look to the right at the charts, we see here that we have ages 12 to 17 in Black, 18 to 25 in blue, and ages 26 and up in the orange. We want to more so focus on ages 18 to 25 and the 26 and up group, considering the fact that ages 12 to 17 don't really work as much as young adults, middle-aged adults, older adults. If we look at ages 18 to 25, we can see from the year 2008 up until about 2014, the numbers are the same. They're stagnant. But once we reach about 2015 and beyond, those numbers begin to skyrocket. Ages 26 and up, we can see that the numbers stay the same between the years 2008 to 2019, and about around 2020, that's when we start to see a shift upward. In this chart, it talks about the top 5 reasons for not receiving mental health services in the year 2020. The first one I really want us to focus on is could not afford cost. This is the leading, and still is in 2022, the leading cause of many employees not receiving the mental health coverage that they need, the mental health treatment that they need within the United States. When we talk about providing these benefits, we understand that this is a cost that is extremely expensive, not just for employees, but also for the employer. So I would suggest doing what Ingram and Associates has done. Ingram and Associates is a well-known psychotherapist clinic within Royal Palm Beach, Florida. I actually used to work for them for several years in their HR department, and we saw cases like this all the time where our employees or customers were coming in and not being able to continue their sessions because they could not afford them. Now, we did have a contract with the Palm Beach County Sheriff's Office, and with the Palm Beach County Sheriff's Office, we would schedule appointments for their officers, and they would have to pay a copay of, I believe, about $10, maybe $15, $20 at the most. This way, we were able to ensure that they could come in, they could get the sessions that were necessary, needed, they could get the treatment that they needed without having to break the bank. When we talk about implementation of benefits, we must keep in mind that no two organizations are the same. We should follow Prudential Financial's lead by conducting ongoing anonymous surveys to learn about attitudes towards managers, senior executives, and the company in its entirety. I stress that these surveys should be anonymous because we want our employees to answer truthfully, honestly. Therefore, we can provide the best feedback and the best plan of action. Based on those results, we would then rein in our focus on what affects our people the most. For example, Tier 1 Performance Solutions focuses on 6 key essential issues: depression, anxiety, obsessive compulsive disorder, schizophrenia, bipolar disorder, and addictions as part of its Start the Conversation About Mental Illness Awareness campaign. I believe that we should follow this wholeheartedly. These are usually the 6 categories in the mental health field that affect people the most, that have the strongest tie on our people. So we want to make sure that we are bringing awareness about this, healthy tips on how to combat these issues, as well as what we can do as a company to support our people along the way of their treatment. One of the companies I really want us to get into right now is the General Electric Company. The University of Pennsylvania and Wharton School partnered with the General Electric Company to test the effectiveness of financial incentives on smoking cessation. GEC spends tens of millions of dollars each year on smoking-related illnesses, which have claimed more American lives than all our wars combined. For every person that smokes, that's $3,400 to the added health care and lost productivity attributable to the average smoker annually. Now, when we talk about the General Electric Company, for those of you who aren't familiar, this is a company that produces all types of goods for the American people, and I'm assuming internationally as well. I haven't really looked into them specifically. They actually volunteered for this study done by UP and Wharton because they have been spending so much money in dealing with their employees who smoke. Incentives included $100 for completing a smoking cessation program, $250 for demonstrating via biochemical test that they were cigarette free after 6 months, $400 for remaining cigarette free for the following 6 months. Only those who quit in the first 6 months were eligible for the $400 bonus. Both groups enjoyed the same generous General Electric Health Benefits Package, which covers tobacco cessation, pharmaceuticals, but does not pay for smoking cessation programs. The results were astonishing. The trial was extremely successful, with incentivized participants giving up smoking at 3 times the rate of their non-incentivized peers. Subsequently, GE has decided to launch an incentive program for all its 152,000 U.S. employees. This is extremely important, simply because providing programs that eliminate health risks, or at least deplete health risks, will save a company far more money than just accepting bad health habits and paying for them down the road through these medical benefits. While federal and state laws require parity in coverage between mental and physical health services, mental health services are more than 5 times as likely to be charged out of network, and in-network provider reimbursement rates are 20% higher for primary care than mental health visits. Those differences create barriers to accessing care, with one survey finding that only about half of insured adults find their plans to have adequate mental health coverage, while the evidence is mixed. Parity has been shown to decrease out-of-pocket costs and increase certain types of care utilization, such as admissions for substance use disorders. Even if treatment is affordable, treating mental health disorders requires adequate capacity of the behavioral health workforce so that access to mental health providers is widely available. As of 2021, 37% of the population live in areas with mental health practitioner shortages. 2/3 of the shortages are in rural areas, but other groups such as ethnic minorities and those in under-resourced urban areas also lack access. In total, over 6,000 mental health professionals are needed to fill the gap. Proposed policies that can help address this gap include expanding programs like the National Health Service Corps, which provide loan repayment and scholarships for those providing healthcare services in underserved communities, and scaling training programs that prepare people for jobs in behavioral health. In addition, increasing Medicaid and Medicare provider payment rates and policies to reduce provider burnout could help expand the supply of mental health professionals.